Live now to Vancouver, where Mayor Ken Sim is providing an update on the response to the tragic attack at the Lapu-Lapu Day Festival.
We want to ensure that Vancouverites and especially the Filipino community feel safe attending future events in our city. I do also want to take a moment to respond to Premier David Evy's announcement about launching an independent commission into the Lapu-Lapu Day tragedy. Look, we all want the same thing: to understand what happened and to make sure that this never happens again. We would also like to see the Provincial Commission deal with the very real mental health crisis across BC. This is about getting families, organizers, and community the answers they deserve and preventing future incidents. And while I cannot comment on the specifics of the criminal investigation, I can confirm that Vancouver Coastal Health has shared that the alleged or the individual alleged to be responsible was under the care of a mental health care team and on extended leave. Now, this is incredibly difficult to hear and even harder to accept because it points to a deeper failure in the mental health system. And I've said this before, and I will say it again: the mental health crisis is not just a health crisis. It has become a public safety crisis. Cities like Vancouver, we're stepping up where we can, but make no mistake about this, we can't do this alone. And that's why I continue to call on senior levels of government to act to expand compassionate mandatory care, to resource secure treatment beds beyond the 400 currently committed. And make no mistake about this, this is just a step in creating a comprehensive mental health care continuum that delivers with different tiers of support. Understanding the gravity of this crisis, we have already taken the lead in addressing mental health where we can as a municipality. So I'd like to recap a few things. First of all, in 2023, we supported Vancouver Coastal Health in developing a plan to expand police health partnerships and launch new health-led crisis response teams. In absence of other supports, our current framework identified by Vancouver Coastal Health is that there is a need for 49 full-time mental health positions to partner with the VPD to divert mental health calls from police-based responses. So far, 38 of the 49 new mental health care workers have been hired. We've doubled the capacity of the CAR 8788 program, which pairs pairs nurses with Vancouver Police Department officers to respond to people in crisis. Mental health professionals embedded in the command center at VPD headquarters have helped divert more than half of the 2,000 calls away from a police response and instead led to healthcare intervention. And outreach has increased significantly, including a 96% increase in referrals to community services and a 46% increase in referrals from housing and shelter partners. And we're now operating Canada's first Indigenous crisis response team. And in May, we'll expand our mobile de-escalation team to 7 days a week. These results show what's possible when we invest in mental health, but they also show what's missing. Mental health is healthcare, and healthcare is a provincial responsibility. Vancouver is stepping up, but we can't and we should not be doing this alone. That's why I continue to call on the province and federal governments to act. We need to urgently roll out mandatory care for people in severe crisis who pose a risk to themselves and to others. And we need meaningful bail reform so repeat offenders aren't cycled back into our communities without proper support or supervision. This tragedy makes the urgency even more clear. Vancouver is doing what we can, but we can't face this alone. We owe it to the victims, to their families, and to every single person across this city, this province, and this country who simply wants to gather with loved ones and their community and feel safe while being there. So thank you very much, and I'm now going to pass it over to Acting Chief Rye.
Thank you, Mayor. Good morning, everyone. Let me please begin first by stating that the Vancouver Police Department continues to support the victims, their families, VPD officers, and the wider community. This tragedy has affected everyone. We are all grieving in different ways, and we are ensuring everyone has access to full mental health and emotional supports. Our Victim Services section have been working around the clock assisting family and friends of those impacted by this senseless incident. Our approach continues to be the victim-centered and trauma-informed process as our investigators work diligently completing investigative steps and tasks. I want to thank our first responder partners, in particular the BCRCMP, for their continuing offer of resources. Going forward, we will continue to stand together in profound grief for the lives lost and the many injured in this horrific tragedy at the Lapu-Lapu Day Festival. Our hearts are with the families, the Filipino community, and all those affected by this senseless act. We honor the memory of the victims who brought joy and vitality to our city. Their loss is immeasurable, and we commit to supporting our community through this pain. In closing, we call for unity and action. Let us come together to remember the victims, support the survivors, and work tirelessly to prevent future tragedies. Their legacy can inspire us to create a safer, more compassionate Vancouver. Thank you.
Okay, thanks, folks. We're going to move to questions. A reminder, a question and a follow-up. We'll do a second round if we have time. Please keep it on topic. As City Manager Paul Mokry will be joining on stage for any questions of an operational nature that are outside of the purview of the VPD. Thanks.
Good morning, Andrea McPherson, Global News. Just for anyone that can elaborate on Lowe's leave from mental health care, what that consisted of. He was obviously, in society at this point. Can you elaborate further on the new information that we have?
I can't elaborate on details. I can tell you, well known that the individual was in the system. And obviously, as the mayor mentioned, the system needs to be strengthened and expanded. We need a comprehensive system. The police are only one pillar of a wider solution. And mental illness, mental health, the vast majority of individuals who are struggling with mental illness are not violent. And it's that gap in the system with the most violent indicators that we have to ensure all the resources are there to help someone in crises.
And do we have an update on the victims that have been so, I guess, critically injured in hospital? A lot of them had severe injuries. Is there an update on them at this point?
Yeah, obviously these are healthcare issues and there's a level of confidentiality. So, even if, we had the information, we wouldn't be in a position to disclose.
Hi, Julie Landry, Radio-Canada, CBC. You keep asking for more help to have more urgent mandatory care. Do you have any indication that in this case, even though there would have been 1,000 more mandatory care, that this person would have been put in mandatory care and that would not have happened? Do you have any indication of that?
No, look, it's a bigger issue than that per se. What I can tell you is the odds of this individual getting the help they need would have been significantly higher if we had those supports in place.
Okay. And follow-up question, do we have any information about other charges that have?
I believe we have a daily briefing, and that'll be later today at Vancouver headquarters, and we'll get you that info on an investigative update.
Morning, Mike Howell from Glacier Media. I just wanted to ask, Mr. Mayor, yesterday the Premier said, and I'm paraphrasing him, that in all likelihood there would be a public inquiry, that he'd call for a public inquiry, but he wanted the criminal investigation to take place first. Would you support a public inquiry into this event?
Well, first of all, I don't think it matters whether or not I support it or not. The province is going to do what the province does. What we're asking for, and by the way, you know, we will support transparency in looking into this. This is a pretty horrific incident, and I want to be very clear. We want to, you know, we're asking for any inquiry to include a review of the mental health aspect of things, mental health supports, and address what we believe could be the root cause to this issue.
Would that be a public inquiry then?
Yeah, sure. As long as it's focused, it includes the mental health aspect of it. That's what we're asking for.
Johnny Morris, the CEO of the BC Division of Canadian Mental Health Association, I talked to him earlier this week, and he said that every time an incident of this magnitude happens across the country, that he would like to see a public inquiry that answers a lot of questions, as the incident being the focus, but then the wider issue that you've talked about, Acting Chief Rye, Palmer, Chu, Graham, various mayors have all talked about this. Is that something that you would see would be helpful to understanding more where the gaps are in the province and in the country?
I'm going to speak from my heart on this one. I think we're all sick and tired of, I think we're really tired of, you know, all the administrivia after this. Sure, let's do these inquiries. But how many more inquiries do we need? How many more reviews do we need? We see a recurring pattern of mental health, people, you know, suffering from significant mental health challenges that lead to significant negative incidents. We already know. Before we came into office, we talked about mental health workers. This is like 2.5 years ago. We have gone through a bunch of incidents since we have come into office where a mental health issue led to a violent act. How many more times do we have to study this? So sure, come up with another commission, come up with another report. They're important, but let's come up with action now. I think we're all tired. And look, I'm sorry, I'm probably going to get in trouble for this, but I'm just speaking from the heart. Not as mayor, but as a resident of Vancouver, as a citizen, as a father, as a family member, as a neighbor, as a friend. Like I look at the list here, like just, you know, I've seen in the news, you know, Richard, Lynn, Katie, 3 individuals, a family of 4, left an orphan son. How many more reports do we have to do to come up for a reason why their family is absolutely devastated? We need action. We already know what the answer is. Or at least we have a really good idea what the action is or what the issue is. We should start addressing that.
Just one more. Acting Chief Rye, just wanted to ask, I know that the VPD apprehends thousands of people under the Mental Health Act each year. Was the suspect in this case ever apprehended by police under the Mental Health Act?
Well, first let me just say the VPD supports the mayor's comments that he just made. We welcome any review, commission, inquiry, because accountability brings change, and everyone must be accountable to help in that change. We've been making changes on the mental health and social issue front for over a decade. 15 years ago, we put out a comprehensive report on where public safety is going. The police are chasing issues that are social, health in nature. So whether this individual was in the system, it's well known he had a number of interactions. Public health officials have confirmed that. and it would be safe to say some of those would be with police prior to getting into the system with healthcare professionals. Do a briefing later, and we'll get you specific details. But we've been shoring up responses on the policing front, like the mayor mentioned. All the mental health caseworkers we brought in, the mental health car, all our officers are trained. Every single one are trained on mental health response mechanisms when they show up at an incident. So we're doing our part, and we welcome any review commission. And thank you.
Dan Fumano, Vancouver Sun and Province. I want to ask, sort of looking forward into the future, beyond this horrific incident, the mayor obviously has asked for a full review of the city's event safety policies. It sounds like we might expect early report back within a matter of weeks. I want to ask, we're just at the start of festival season now, and it's at a time when a lot of major festivals that have been around for a long time have already been struggling with putting on public events with finances. Some have been canceled. Long-running festivals have been canceled. If we add additional security requirements, is that going to mean that we have fewer events in the future? There's more than 2,000 per-minute events in Vancouver every year and another 1,000 protests or so. Is it possible to strike a balance? Is there a challenge there trying to strike a balance between making sure everyone is safe and that festivals are actually viable? Or should we expect that there will be fewer public events in the future?
Yeah, look, we're going to have a report out, a preliminary report in a couple of weeks. So maybe I'll answer that from, if I were to step back and sort of envision what could happen. Yeah, look, there are a lot of areas that are at risk, and it's not just festivals. Okay, you can talk about any intersection in the city of Vancouver. You can talk about the beach. You can talk about schoolyards. You can talk about patios. Okay, and so look, there will be a review, and we will get stronger for it. And I think people have to realize that, if you go to the root cause, this is a mental health crisis, which is manifesting into a public safety crisis. We will not be able to, I already know, I don't even need to see the report to let you know that we will not be able to secure every single target in the city of Vancouver. That's just, it will not happen. And so, we will, do our best to make sure that we reduce the risk at main events. And we have to get to the root cause of the problem. Because if we don't, expect to see less events, less of everything in the city of Vancouver, and that's not the city that we want to live in, I don't think.
Is it your hope that the city can continue to have a vibrant cultural scene, both with major events, but also, as you say, beaches, public places, plazas, patios? Is it important to you that the city does still have that kind of vibrant?
Absolutely, and that's what we're striving for, and we'll continue to strive for it. And I just want to be very clear as well. We need to get to the root cause of this issue. And we are dealing with the mental health crisis that's manifesting into a public safety crisis. And so we need to daylight those conversations, which we have in the past and we continue to do. But we need meaningful action on this now. Thank you.
Good morning, Reagan Haskow, CTV Vancouver. I'm just wondering, I believe the last update, there were still some victims that had been yet to be identified. Is that still the case? And I'm wondering if you even know...
We've been listening to Vancouver Mayor Ken Sim providing an update to the media in response to the tragic, deadly attack at the Lapu-Lapu Day Festival over the weekend, and expressing a lot of personal concern about the current state of mental health crisis in the province and in his city. We'll have more on that announcement throughout the morning and afternoon.